Hi, I'm Dr. Jessie at the Healing Collective in Niwot, Colorado. This is a video, it's a bit of an addendum, it's an add-on for a video that I made quite some time ago about hope for concussion and post-concussion syndromes, because there's some new information that I really want to share with you all. And if you haven't seen that video yet, I'll briefly summarize the way that we support acute concussion and chronic concussion syndromes and mild traumatic brain injuries is I use a technique that actually helps to mobilize these sutures and mobilize the cranial bones so that the alignment of these bones is appropriate. So you can think about a chiropractic adjustment that puts the spine back into alignment. With any blow to the head, the cranial bones can actually just have very small but significant misalignments. And because of all of these foramen, these holes at the base of the skull where our nerves go into and out of, and our vascular system, our veins and blood and arteries, blood vessels, and lymphatics travel in and out of these areas, making sure that the alignment of these structures is really is important, because it helps the input and output flow of the system after a concussion. It is so common that after a blow to the head or even a whiplash style injury that these bones are slightly misaligned and can be occluding or pinching, for lack of a better word, some of these structures. So making sure that those are aligned is really important. And the way we do that is with gloved hands, go inside of the mouth, access the sphenoid bone, which is the pink bone, which articulates with almost every other bone in the cranium here, and make sure that that's in alignment. And when that's in alignment, generally the other structures remain in alignment as well, or return to alignment. I also utilize frequency-specific microcurrent, which is pulsed electrical current with specific frequency instructions and we can target very specific structures, brain parts, the nerves, vascular system, etc. So if you meet a FSM practitioner who, frequency-specific microcurrent practitioner, who only uses the concussion protocol after a concussion, know that there is much broader help available to you with someone who is more experienced at treating a concussion. I get calls frequently regarding post-concussion treatment, and people have tried FSM and they're like, yeah, the concussion protocol is helpful, great, but I still have these lingering effects. It's because there's many other parts of the brain that are involved than what the concussion protocol covers. So make sure to seek out an experienced FSM practitioner that treats multiple brain parts and the nervous system and the after effects of scarring and bleeding after a concussion, whether it is acute or chronic. So FSM is really helpful. FSM, well, a concussion experience is why I even got into FSM as a physical therapist in the first place. One of the people very dear to me had a concussion, and 4 years later had a very, very challenging kind of downturn in his health, and Carol McMakin and frequency-specific microcurrent really got him back on his feet, able to go to grad school with flying colors, and that inspired me to go into physical therapy so that I could use this modality. It's amazing. We also use at this clinic pulse electromagnetic field therapy. So we've got the frequencies that are basically instructions for the cells pulsing through this little device, which creates a magnetic field and helps to treat these structures as well. So those two therapies combined, plus the manual therapy and the alignment of the cranial vault, are often very, very effective at treating concussion and post-concussion in the cases that I have seen here in the clinic. Now, the one thing that I'd like to add, because I have been seeing a little bit more of this lately especially, is because this sphenoid bone has this little structure right here. It's called the sella turcica, the Turkish saddle, and in that little saddle sits your pituitary gland. Your pituitary gland is the master endocrine gland that regulates hormones downstream in the body. So the adrenals, the thyroid hormone, the ovaries or testes producing their hormones. This gland can, in the case of a blow to the head or a whiplash injury, get rocked or shaken a bit in its structure and can get concussed, so to speak. And so it's important to really track and screen in patients. Are you having changes in weight? Are you having changes in your thyroid function? Are you having changes in your adrenal function, which relates to stress hormone cortisol, as well as other things? Are you having changes in your menstrual cycle after a concussion? All of this can be related to the concussion because of that pituitary gland effect of the blow to the head. So it's something that I really wanted to call your attention to, because if you are undergoing concussion treatment and are having some of these weird effects that maybe your provider just isn't making the connection that can be something that happens, consider a functional medicine provider who can screen your endocrine system, right, with various lab tests, and a provider who can really treat and support these structures in the brain. So I hope this is helpful information for you, and please know that I am happy to talk to anybody about post-concussion treatment. I offer free 15-minute consults, so just call our office and I'd be happy to chat with you. It is my hope that this is just really helpful information and helps you to be educated about all of the options out there that actually do exist about treating concussion more effectively than what might be commonplace in mainstream medicine. So take care and be well.